Welcome to Emergency Medicine Fellowship Match Advice, a new Google Hangout web series sponsored by your friends at Academic Life and Emergency Medicine, and its editor-in-chief, the woman whose face I want to see on the $20 bill, Dr. Michelle Lin from UCSF.
Oh my God, can I nominate myself? Hello.
I just did.
That's fantastic. I feel like we're like the Wonder Twins. What do you think?
We are. Here's my finger.
Best buds.
There you go. All right. This is, thankfully, the third and final episode in our new EM Match Advice spin-off series, people. EM Match Advice, the Fellowship Edition. This is Season 1. We'll see if we come back for Season 2. Today's topic is entitled EM Match Advice for Medical Toxicology Fellowships, which I will, for now on, just refer to as TOX. But Medical Toxicology Fellowships, how do you match to one? Well, we've got 3 outstanding fellowship directors here to offer their sage advice. Our first panelist is Dr. Binh Ly, a residency director and vice chair of education known around the world from the University of California, San Diego. Hi, Binh.
Hi there, Mike. How are you?
Great. Thanks for joining us. We have Dr. Christopher Hoyle from Denver Health. He's the fellowship director at Rocky Mountain Poison Center, where he is also the associate medical director. Hi, Chris.
Hi.
And last but not least, Dr. Robert Hendrickson, the fellowship director and professor, new professor. Congratulations. Oh, and Michelle Lin is Professor Lin. World, we haven't talked about that recently. Congratulations to you both, Professor VM at Oregon, OHSU. So thanks for being with us.
Thank you.
All right, we're going to get started with our first panelist, Dr. Ly from UCSD. And, you know, big picture question, Ben, why does someone choose to do a toxicology fellowship? Who would do that to themselves?
Yeah, you know what, I agree. You know, in making a decision to do any fellowship,
there we go.
I think one must be incredibly passionate about the particular field, maybe even pathologically so. You know, during my own fellowship, I never learned at the pace and depth that I did during fellowship at any other time in my career. You know, most individuals that I've interviewed for fellowship positions pursue the additional training because they were fascinated by the pathology of cases they saw during residency. This is understandable, as there are a lot of cool cases, as everyone on this will attest. I'm sure you've all seen great poisoning cases, and they typically require detailed understanding of basic science and pathophysiology, and hence the pathologic part of being passionate of pathology.
All right, well, you know, I have an old analogy that I tell my residents, which is you go to fellowship much like folks choose to do a PhD, right? PhDs don't necessarily get you any more money. You do them because you love the subject matter and you want to study it in depth. I think that's essentially what you're saying.
Well, even more so is if you do a medical toxicology fellowship, you are probably going to be relegated to a life in academics and make less money rather than more money.
Just like PhDs, exactly. All right. So give me the general structure of a toxicology fellowship. You know, they vary, I think, even on this panel in the number of years and the curricular options that are out there. Could you just speak in general terms what tox fellowships look like in structure?
Sure. You know, the field of medical toxicology is incredibly broad, with poisonings occurring from, you know, over-the-counter medications, prescription medications, legal and illicit drugs of abuse, you know, foodborne illnesses like botulism, mushrooms, plants, even envenomations from a variety of creatures. You know, just as broad as the source of exposure, you also got to consider that toxicity may impact any and every organ system in the body. So as you can imagine, the body of knowledge to master is vast and truly necessitates the required 2 years of training following completion of residency. So if one's thinking about applying to toxicology, they should be aware of the main training formats and the critical components of training. Let me just kind of briefly review this for you guys.
Please.
You know, from a structural standpoint, emergency medicine residency programs are typically based at university medical centers, county hospitals, private community hospitals, or some blend thereof. And each format really brings a unique educational experience. You know, similarly, medical toxicology fellowships are also organized around the resources of the sponsoring institution. Most EM residents are familiar with and have called poison centers for advice at some point during their residency. Poison centers are basically regional telephone banks, typically located at major university hospitals. The poison center staff are typically pharmacists, nurses, and sometimes physicians trained in the care of poison patients. Most calls to poison centers come from the general public. You know, the chief complaint is usually, my kid ate a little red berry, or they ate a little brown mushroom. Healthcare facilities also call poison centers, and occasionally law enforcement calls we get in San Diego here. You know, at these programs, the poison center serves as the primary clinical experience for the fellows. The fellows can man the phones themselves and take.
This is our lean-in moment where we. All right.
Offer, fellows take call and respond to consultations just like any other consulting service. You know, some programs like ours also offer a primary admitting service. At my institution, we function as both a consultation and a primary admitting service. We will typically admit patients that have isolated poisonings or perhaps envenomations that we take care of from beginning to end and discharge from the hospital, and we'll eventually follow up in our clinics as well. Now, there are a few programs in the country that are sponsored at a pediatric or a children's subspecialty hospital. In fact, when I was a resident in Fresno, California, the Poison Center was located within the regional children's hospital. Even when programs are hosted at pediatric hospitals, the applicant should also understand that clinical exposure will not be limited to children alone. Interestingly, most adult physicians may not know this, but the specialty of toxicology was born from pediatrics, although the majority of practicing medical toxicologists now in the 21st century are primarily boarded in emergency medicine, like all of us here. You know, on that note, I should also, you know, advise everybody that the RRCs that accredit medical toxicology programs is mostly emergency medicine. However, the preventive medicine RRC also accredits medical toxicology fellowships. At this point, I'm only aware of 2 remaining programs in the country that are accredited through preventive medicine. Both are in California. We're one of them. The other is in San Francisco. It's possible that the preventive medicine RRC may transition these programs to the emergency medicine RRC in the future, as right now the faculty and program directors are pretty much boarded in emergency medicine. So they are really de facto emergency medicine programs, but I'm not so sure how the preventive medicine residency is really going to react in the future. For now, we have no plans to migrate from preventive medicine to emergency medicine, because I think really from an applicant's perspective, the fellow's perspective, they should be aware that there is a distinction here, but functionally and educationally, there really isn't much of a difference under which RRC a program is accredited. You know, one other thing is that because ALiEM sponsored this hangout, I suspect most of this audience is going to be from emergency medicine, and their interest in toxicology was stimulated by emergency toxicology. Prospective fellows should be aware of an important component of fellowship training in tox, and that's in the arena of occupational toxicology. During fellowships, the fellows can expect to receive educational experiences in occupational toxicology. These exposures occur in the workplace and are usually more chronic in nature and perhaps insidious in progression to disease. Exposures typically involve chemicals, metals, perhaps gases. In management of these chronic types of exposures typically do not occur during EM residencies, which is kind of the reason why I just want to bring it up to all of you.
Okay, well that's great. You know, the format of these programs, most are 2 years, correct? That the implication being that there's not 1-year fellowships, right?
That's correct.
And then there are some that are 3 years.
Right. All accredited programs are at least 2 years. Some offer an additional year with additional experiences. We haven't had a fellow decide to pursue this. We actually offer a 3rd year with a concurrent MPH at a local university here in San Diego.
Okay. So the 3rd year tends to be a research heavy option. It's a scholarship add-on.
Yeah, you know, and that's a good point that you bring up with respect to research. I suspect, I don't know for sure, but pretty much every toxicology fellowship program I'm aware of contains a research component. So you'll probably be doing research during the 2 years of your residency training, but if you choose to do a third year, yes, there may be an additional requirement for research and presentations. Any of the other guys have any comment on that? Because I'm speaking purely from my own experience in that area with respect to that third year.
Chris, you're at a 3-year. You run a 3-year shop, correct?
No, our fellowship is 2-year.
Oh, it's 2-year. Okay, you kept one of my grads back a year because I thought she was there for 3. All right.
Yes.
Well, I think my question it stems from the special skills I think that toxicologists tend to have, just in general. They tend to stick around academics. They tend to be at least research-oriented. They usually, if they're in a general residency program faculty, I find that they're the go-tos a lot of times for study design and research methods for the residents. And certainly they win all the teaching awards. I don't know how you guys do it, but you're always the best teachers. It drives the rest of us crazy. So I wonder, is that a component of the fellowship training? I mean, is that something that your subspecialty really broadly has just focused on as an important aspect of skill development?
Yeah, I certainly think so. I think the specific skill that I try to develop in all my fellows is really the ability to critically analyze a case in greater detail than they have ever analyzed before, and employing knowledge that has been acquired pretty much throughout their lives. So I think because of that level of analysis and perhaps understanding of physiology and pathophysiology for that case, it allows an individual to potentially be a better teacher. Now, emergency medicine, is an incredibly broad field, and I identify myself as an emergency physician. Its practitioners are incredibly skilled, and they are emergentologists, and I think it's a coined term years ago. However, I think there are very few areas in emergency medicine where the emergency physician is the final authority on the subject matter or care of that patient, for that matter. And I think once you get boarded in medical toxicology, I think you end up being the final authority in the care of poison patients and envenomated patients at any institution. So I think, yes, we do teach research methodology. It's kind of ironic a little bit because some of the worst studies done in medicine are done in toxicology. But I think we require the analysis ability to be able to teach, what's good and what's potentially trash here. And then teaching, I think all the toxicology fellowships do this really well. We have rounds, we have poison center teams that comprise of medical students, pharmacists, nurses, residents, and potentially even fellows from other subspecialties. And we require our fellows to pretty much teach on a daily basis, and they teach more in a chalk talk format rather than a didactic PowerPoint presentation. So I think that's probably why you're seeing a lot of great teachers come out of toxicology.
All right. Well, let's move on from the skill sets you obtain and talk about applying them, and we'll get into a little discussion of job opportunities with Dr. Hoyle from Denver. So, what job opportunities exist? It sounds like most of them are at academic medical centers. Is that true?
So I would agree with Ben that most fellows, especially most fellows from here, end up going into academic positions. However, we are lucky that surrounding our fellowship and many other fellowships, there are opportunities to get into, to do some things and get into some disciplines outside of the academic world. So for example, there's a group that's associated with our Poison Control Center who work as a private group. There's a group of 5 board-certified toxicologists who really, they see patients in a private arena, but then they also, most of their time is spent on doing consults. So they get a fair number of consults, whether or not from pharmaceutical companies or from the U.S. government or from various entities in industry, whether or not doing medical legal cases, that's where they spend most of their time. So there's plenty of opportunities to be a consultant and do some private things. We also, interestingly, we have an R01 funded researcher who is a toxicologist that works at the university, who's affiliated with our Poison Control Center, and really his entire day is spent doing, he does cyanide research. And so he is an R01 funded researcher, and basically 95% of his time is spent doing research, tox research that he loves. So there's opportunities to do that, of course. We have, one of our attendings is a vice president in a pharmaceutical company, so there's a lot of industry jobs. We just had one attending take a job at Amgen to be one of the heads of their clinical trials. So if you want to get into an industry job, there's industry jobs for toxicologists. If you want to be the medical director of a poison control center, you have the opportunity to do that, of course. And one of our attendings, he works actually for the United States government now as a consultant for biological weapons. That's his area of interest. And so despite the fact that I would agree that most toxicologists probably most would pursue a job in academic medicine, there are opportunities certainly outside of that to do other things.
Okay, well then let's perhaps focus on the most common then. So the vast majority of residents who go through medical toxicology will come out the other end in academics, working perhaps at least part-time at a poison center. Kind of describe what their general job description looks like. What's a normal week in the life of a toxicologist?
So interestingly, so the university, so our poison control center is affiliated with our university hospital, and so I think that there are eight attending toxicologists who are primarily full-time university employees. And they really have a split between working in the emergency department and then also taking some call and doing some consulting work for the Poison Control Center. Most of them have a split, I would say, that's probably around 60-40 between working in the university and then doing some tox-related things. So a weekend, let's say a week in the life would be to work a couple of shifts in the emergency department, take some call, be present for fellow rounds, kind of like Ben described, and then in the meantime, they're working on whatever their tox interest is. So that could be, we have one person who's interested in personalized medicine, so he does his personalized medicine research. We have a person who is primarily interested in social media. He does a lot of, he does some podcasts, but he does a lot of stuff with social media. So outside of his ED shifts, and outside of taking some call for the Poison Control Center, he also is active in social media and podcasts. So based on whatever the specific interest of the toxicologist is, you can work, you can do your ED shifts, but then also spend the other part of your time doing whatever your interest is. Now, that varies, of course, so I don't want to make that sound like that's the only way that happens, because it varies from place to place, from institution to institution, because there are some toxicologists who graduate, they go and work in ED and do the vast majority of their time is spent just doing ED shifts. They may do some lectures for the residency, tox-based lectures, but for the vast majority of their time is spent working in the ED. So it really varies. Here, the university and the Poison Control Center have a pretty good relationship in that way. So once a tox attending is hired, we try as hard as we can to find time for them to do, to make time for their other tox-related interests.
And what about inpatient tox services? How common are they? Do they need more folks to sort of join their ranks, for instance?
Yeah, so it's interesting. We have three institutions that we see bedside consults in. One is Denver Health, one is the University of Colorado Hospital, and the last one is the Children's Hospital of Colorado. And so in each of those institutions, we have attendings that actually are responsible for the bedside consults. So our fellows go see those cases and then come in and round with the attendings on those cases every day. And so and I can tell you, just in the last month, for example, at Children's Hospital, we saw 27 inpatient consults, new ones, for that month, which is probably about average, maybe a little bit more than our average, but right around the average for Children's. The University Hospital and Denver Health, a little bit less than that, probably in the 10 to 15 range per month. So they're decent. I'm sure that the other panelists here probably maybe have a little bit more robust adult inpatient services than that, but there are a fair amount. They're fairly active inpatient teams and consults that go see these patients through our poison center.
And would you say most sites that sponsor a medical toxicology fellowship have an inpatient service for that experience, or is that not necessarily common to all fellowships?
So, to my knowledge, all of the fellowship programs do have the opportunity to go and see inpatient consults as a part of the fellowship, because of course that's one of the disciplines that you need to kind of to nurture is being able to go to the bedside and evaluate a poisoned patient. So, I mean, if you're going to have a fellowship, most places where you're going to have a fellowship program, they're going to be that service.
So what's the job market like these days? We're in 2015. I figure this will last for a couple of years in terms of its current nature. So next few years, what would residents, thinking about med tox, would they have jobs at the other end?
So I'll tell you, first, just to take a step back, Denver is ridiculous. So we have 24 attending toxicologists in the city of Denver, which is way too much.
I don't know. I mean, I've heard a lot of things about Colorado and Denver in specific. I mean,
yeah, that's right.
You need a ratio of like 1 to every X number of people that live there.
That's right. Yeah, exactly. There needs to be a toxicologist for every 3 people here.
Right.
We do smoke a lot of marijuana, by the way. So we need somebody to be here for that. But I can tell you for the job market, when I graduated from fellowship 3 years ago, and I think I've applied to 5 different academic places for jobs. And at that time, the job market was decently fertile, so there were jobs open. Our fellow who just graduated last year, who took a job, he went and he found the job market actually pretty open, so he got offered basically all the spots that he applied to. He got offered jobs. So I would say right now, in our particular area, the job market is actually pretty good. Our chairman at the University Hospital has hired a toxicologist every year for the last 5 years. So on the other end, as far as in this area, it looks like the market is okay. As you know, getting a tox job where you're going to work 100% toxicology is probably rather difficult to do at this point. But I'm not sure what the other panelists think about that.
Ben, what are your thoughts?
I think he hit it right on the nail right on the head. I think there's other areas as well. One other area that comes to my mind as far as being able to gain meaningful reimbursement for what we do is the medical legal setting, where toxicologists advise attorneys, whether it be plaintiff attorneys, defense attorneys, perhaps prosecuting attorneys, on the toxicological aspects of their cases. And some toxicologists will do quite a bit of that, some do none of that, but I think that's potentially another area where we will potentially have some expertise and lend some assistance to the understanding of cases. Now, as far as the job market itself, I think the job market is relatively fertile. There are only about 400 toxicologists in the country. And I think most, when I ask the residency applicants, I ask them how many toxicologists are at the programs that they interview at. And the answer is typically 1 or 2, often 0. So I think if you're going to pursue an academic career, I think there's potentially a lot of opportunity out there. Now the jobs, just like Chris said, is the jobs where you're doing 100% toxicology. I think those are few and far between. They are out there, but they are few. Most of them, you're doing some blend of emergency medicine and toxicology.
And Rob, what are your experiences briefly, just with your grads? Are they seeing a wide open market?
Yeah, I mean, I would agree with what both of the panelists said. I think certainly a toxicology fellowship gives you a really, really good basis to get an academic job. And though there may not be a lot of academic emergency medicine jobs out there, certainly my graduates have been very, very competitive, and we've been very, very successful getting people academic jobs. The fellows that we have had who have preferred to do community emergency medicine mostly, and then some toxicology, have been incredibly successful, and I think they also have a leg up on the competition when it comes to getting hired in the community, because they're the tox person in the community emergency department, and that can go a long way and lead to a lot of opportunities. So I think the message to applicants is that toxicology brings a lot of options, and you can carve out the percentage of your jobs that you want to be doing a lot of different things, and you can kind of make your own ideal job and ideal career. So, options.
Yeah, I mean, that number of 400 toxicologists that are boarded total, that's surprising to me. When you think about the context of 4,000 plus emergency departments in the country, that's a good ratio.
It is, and most of them are in Colorado, apparently.
Yeah, right. Seriously.
Apparently. Yes. Yeah, we'll talk about that at the end. All right, so we're going to stick with Dr. Hendrickson from Oregon and kind of talk about the application process. Mm-hmm. So nuts and bolts, how do you apply to a toxicology fellowship? Timeline, when does it occur, when is the match?
Yeah, I'm glad you asked me, because it is a little bit different from what a lot of the listeners might remember from the EM residency application process. It is pretty straightforward, but let's go through sort of the steps. The first and probably the most difficult part of the equation is figuring out which fellowships to apply to. And I think you can get some advice from mentors, toxicologists in your programs, as well as you can go to the SAEM or ACMT, that's American College of Medical Toxicology, websites to take a look at where the fellowships are in the country. And acmt.net has a really nice site where they have a map, and you can click on the location, and it gives you some basic information about the program and then a website. So I think most applicants start at a site like that, then go to the websites to get a little bit more information about the program itself. Mm-hmm. And then the part where it's a little bit different is you really just have to find the program director and or the program coordinator's email address on the website, and send them an email, and that's really your application. I think for the most part, adding a CV and maybe a letter of intent is pretty typical. So I get a lot of email, I'm interested in applying to the program, with a CV and a letter of intent attached. At some point along the process, most programs will require 3 letters of recommendation, although that varies a little bit with program. And then your application process is complete, and that then leads to interviews. And then the last step, which is really important and a little confusing to some applicants, is we do have a match in toxicology. So you do have to register with NRMP, and we do go through a match process. So that's where things are a little bit different, but that's pretty much it.
Okay, and what time during the year does all this happen?
Yeah, so that also varies a little bit with program and with the applicant, but I think what I think of as sort of the target time to apply is about July of the year before. So exactly a year before you would start your fellowship. So we certainly get applications May and June. I certainly get them in August and September, but July I think is a good target date. That'll give you August, September, October to interview. And then the important dates in the calendar, the first week in November, is the rank list deadline. So that's the day when all of the programs and all the applicants have to have their rank lists into the NRMP website. And match day is the 3rd week in November.
Right before Thanksgiving.
That's right.
Nice.
Yeah.
Yeah. All right. How many?
Eat without having to worry.
You'll bore your family with tryptophan and other chemical discussions.
Exactly.
I see it happening. I see it playing out. Number of programs, number of unfilled spots per year. Is it buyer's market, not a buyer's market?
Yeah, so there's about 30 fellowships out there. And there's about, I don't know the exact numbers, maybe the other panelists remember the exact numbers, but there are about 30 or 40 applicants. So you end up with a couple more spots than there are applicants, which is going to leave some spots unmatched every year.
Okay. And is there a scramble for the unmatched person? Can they then get those spots outside the match after it's already completed?
Right. So there's no formal scramble, but any program can take any applicant after the match. So once the match is done, if you haven't matched, you start the process over, you contact the program director. So it's not a formal scramble where things have to be done on a deadline.
Okay.
You can then go interview, and you can certainly be taken into a fellowship program at that point.
All right. And, you know, we certainly talked about some of the programs offering a graduate degree, you know, an MSCI or an MPH with their experiences. Are those generally built in, or do you wait, you get matched, and then you need to apply to those graduate programs in a separate cycle?
Yeah, this is a great question. This is a really good thing for applicants to explore before you apply, or not necessarily before you apply, but before you interview, and then during the interview process as well. Get a real good idea of what sort of extra didactic, extra coursework there is either available or mandatory for you. Some programs do combine an MPH, an MCI. We have a Master's of Clinical Research, an MCR, here at OHSU that you can take. The master's programs are a really good sort of a structured way to learn what you, if you want to learn that topic. I think that in many situations, getting a master's degree during a 2-year toxicology fellowship will be difficult from the time perspective. So I recently graduated a fellow who did his MPH during his 2-year fellowship. He certainly did a great job, and he did a great job in his fellowship, so it's possible. But it does take a lot of time, and people should know that. But I think when it comes to these extra courses, the real key to think about if you're applying is it going to give me the skills that I want? You know, what is my long-term goal, and what skill set do I need? So for some people that's an MPH, for some people that's a MCI, and some people that's an MCR. But there are other options out there too. Our program, we do have an MCR, we do have an MPH, but most of our first-year fellows do a 1-year course that is an MCR course, but they don't get their master's degree or certificate. It's a course on clinical research design and research methodology, which I think is a real core part of learning toxicology for the reasons that we were talking about before. Either doing your own research or reading and analyzing research, but that they don't get a certificate or master's necessarily. We also have other options. In our second year, our fellows do a course in forensic toxicology and pharmacokinetics, and they learn how to do pharmacokinetic modeling. So some of the issues that Binh was talking about analyzing cases, legal cases and medical cases. And then we also have a year-long second-year course. It's like once a week called the Education Scholars Program, which is really about teaching people how to be a better teacher. So for our fellows who are interested in being academics, interested in doing teaching, it teaches you about bedside teaching, about didactic teaching, about adult learning theory, about how to develop an educator's portfolio, and all those things you'll need for promotion and tenure. It's a great course, and for the fellows that I have that want to do education, they want to teach, we very much encourage them to take that. So I think the courses, you have to look at them, you have to decide if they are the ones that are going to make you the absolute best that you can be and get you to where you want to be 5, 10, 15 years from now.
All right, great. I have some questions about you know, how to judge competitiveness amongst the applicants for the whole panel, but I kind of wanted to pause for a second and see if Michelle had any questions or thoughts about what we've heard so far.
Yeah, no, I was just thinking about your initial question of like, why do people do toxicology fellowships? And I think it's because you guys have the best stories, right? Like, you're like what? They drank what? And I think that's kind of the hook that people have, as well as with ultrasound fellowships. Tox has, you know, universal clinical applications, no matter where you work. So I find that extremely appealing, and that you're still kind of a pluripotent cell in that you can still go many different ways, like academics, community, or as Chris mentioned, he says government consultant, which means for me like spy. I mean, I guess you could be a spy. So I mean, I think you could do a lot of different things, and so I'm intrigued. I had no idea that there were so many different avenues. So continue. I'm learning lots. I'm taking good notes. I
mean, somebody has to create the antidote that they drink in Mission Impossible, right? Like, I would assume it's these guys.
Right.
Clearly.
Absolutely. Absolutely.
I can neither confirm nor deny my involvement in that antidote.
I've got a lot of questions for you guys. Lava lamps, lipids, and why you're killing me with them. There's going to be a lot of topics for Slee to get to. All right, but let's go to Binh, and let's talk about why applicants may or may not match. What makes an applicant competitive for medical toxicology fellowship positions?
You know, the applicants are in a good position, as Rob mentioned. There's usually more positions than there are applicants. Now, the programs are also in a really good position because there is a tremendous amount of selection bias amongst individuals who make the decision to apply to a toxicology fellowship. Number one, they got to have a tremendous interest in toxicology, and that's usually going to be demonstrated and very evident throughout their residency. And you know, occasionally we'll have latecomers and late bloomers, but I think most individuals will figure out that toxicology is important to them. They are fascinated by it, probably by the middle of their residency, depending if it's a 3 or a 4-year program. So I don't think necessarily that you have to be, coming out of the womb, I'm going to do toxicology, but
would be strange.
Demonstrated interest and consistent interest is a good thing. You know, things that I look at as far as evaluating the competitiveness of an applicant, I want to look to see what teaching have they done in residency in toxicology. You know, have they given lectures? Do they give case conferences? Did they put some scholarly work together? Did they publish a chapter, co-author a chapter? Most of the time they're not going to primary author something. Did they do any research work in the area? Now, all of these things are nice. They're not mandatory, and I think most of our applicants will have several components of those, and the ones that we successfully match usually have some teaching, little to some research, so I don't think that's a major component. But they all have some scholarly work. They've written a newsletter, co-authored something with another one of the toxicologists, maybe even did a presentation at a national meeting on a toxicology topic. So I think those are the things that allow an individual to match in the place that they want. If they want to do a toxicology fellowship, I think they're going to be able to secure a position fairly easily without a lot of stress. It's more if you want to be somewhere in a competitive place like Denver and Oregon, I think you're going to have to bring something else that separates you from the group besides being just a good clinician. Because we all assume that once you graduate from a ACGME accredited residency program, you're going to be a satisfactory, if not excellent, physician. And now, are you ready to spread your wings and fly? And I'll tell you, occasionally, one of the things to avoid when applying to a fellowship, occasionally individuals will reveal that maybe they didn't get the best toxicology experience during their residency, and they want to augment or supplement their residency training with a toxicology fellowship. I'm not so sure that's a good reason to go in and do a toxicology fellowship because it's really an additional 2 years. I would perhaps go back to my residency director in that situation and say, hey, how can I get more of a toxicology experience, either to solidify my clinical skills or to determine whether I want to devote 2 more years to a fellowship. That's what I would suggest there.
You know, Chris, I think Binh sort of set me up for the question I'm going to ask you. And, you know, there's a lot of tox rotations around the country that are very, very good, but not all residency programs have tox rotations. Some programs, in fact, have to, you know, send their folks on a plane a great distance across the country to be able to have time at a at the poison center. So what do you do with those applicants, perhaps, that are coming from programs that don't have a mandatory tox rotation? Maybe near the end of residency, they're starting to think about tox. They don't necessarily have the opportunity to get an elective and you know, check all the boxes. You know, I did research in it and teaching in it, and I published in it. What do you make of those candidates, and how do they present their interest in a way that's still going to, you know, ring true with you, the fellowship director?
So yeah, it makes a little bit of an issue, right? Because I think we all here have plenty of students that come in, or excuse me, residents that come in to do away rotations And
Okay.
either one, they want to do their way rotation at your place because that's where they want to do their fellowship, or number two, they do it because, like you said, maybe they didn't have the best tox rotation experience in their residency. So it makes it difficult in the evaluation of a resident, but it also makes it really easy because then you get a resident in front of you and you see what kind of enthusiasm they have for a tox rotation. You see kind of, how much work are they going to put into it. Like Ben said, you also kind of can tell, well, what's the motivation? Is it because you feel like you needed to get another tox experience? Or are you coming because you really want to become a tox fellow? You want to be a medical toxicologist, and so you're going to put all the work into it. So while on the one hand, it doesn't allow, if you don't have a tox rotation as your residency, and it's a little bit more difficult to get your hands dirty in toxicology early, that makes it a little bit more difficult. But I think that by doing an away rotation, like you mentioned, Michael, that it makes it easier for me, for example, to really evaluate someone who wants to come and be a fellow and is coming here to kind of showcase themselves. It makes it a little bit easier to see them in person. So by all means, we encourage that, and it makes it easier for all the attendings to evaluate a resident. And just really, what it boils down to is, how much interest and enthusiasm do you really have in doing this? Is this going to be a hobby for you, or is this something that you really kind of want to make a lifelong career from? And so in answering your question about the way rotation, I use that month or two that a resident comes in to really evaluate them while they're here.
Yeah, maybe I'm seeing a theme here, and I'm comparing it. We just filmed similar fellowship match advice episodes for SIM and for ultrasound, and certainly there's two examples where you can kind of get a little ultrasound and a little SIM during residency, but most programs don't necessarily have a SIM month. Perhaps you use elective time, but not everybody does, and I think most places probably have ultrasound built in some form or fashion, but certainly not everyone. But you guys are really starting to make a theme here that you want some content experience or exposure formally, and my guess is one of those 3 letters of recommendation, Rob, that you mentioned, probably you're expecting them to come from a toxicologist that led that rotation. Am I right? Is that a fair statement to say?
Yeah, absolutely. Yeah, and I think there's a lot to be said for Ben said before, there's 400 toxicologists in the country. Most of us know most of each other, and so getting a letter from someone we know, i.e. another toxicologist, is very helpful. I think on the other hand, there are people who are training in places that don't have a toxicologist, and so I don't think we necessarily hold that against people, but it does help, I think, if you do an away rotation or if you do a rotation within your institution, getting a letter from that person is going to be, we're going to weigh that very, very heavily because the rotation will be similar to being a fellow, and we see the same characteristics.
All right, well, that's actually something great for me to have learned today that that I'll take away when I'm counseling residents. I think that's really important information. All right, so my last questions are also for you, Rob. Just we're talking about the actual interview. When one goes to interview at a Tox fellowship, what's their interview day sort of like? What questions should they be expected to be able to answer? I think we could guess at some of them given what the discussion has been. And then importantly, what questions should they be asking of these fellowship directors so that they're doing their due diligence?
Yeah, so I think, interestingly, the interview day is very, very variable, and it really does depend on the program. And there's a lot of factors that go into that. But I think in general, you can expect to interview with several of the toxicologists that are there at that program. I think when you go on your interview, as far as what questions you can expect, I suspect that we're not getting a lot of really, those sort of strange businessy, if you were a tree, what would you be and why, and those types of things. What program directors want to know is why. Why have you chosen toxicology? And this seems to be a theme that keeps coming up where each time one of us speaks is, I want to know what got you interested in toxicology, what gets you excited about toxicology. I want to know what you want to do with the fellowship. If we spend 2 years training you, what are you going to do? What's your plan? And And kind of where do you see yourself going in a couple of years? Are you going to do academics, community? What is your goal for doing the program? And then also, I think people are going to ask you, why my program? Why Portland, Oregon? Why OHSU? How do you think that'll fit into your training? And then, I think that's really the core questions that you're going to get. I think some of the other questions that I think a lot of people like to ask, and I think it's more of a way to get people to talk and to get the answers to the questions I just mentioned, is sort of like, what's your favorite toxicology case in your EM residency? Tell me about it. And what did you do? Why were you excited? Why were you interested? Why didn't you just admit them and and go to the next patient? Why did you get really excited? Why did you spend all that time thinking about it afterwards? And I think that's what we want to see. We want to see your interest in toxicology.
Okay. And in terms of questions you should ask of the program?
Oh yeah. I think that the main thing that I would recommend as far as asking questions of the program is really, how are you going to learn? And I think, there is not a toxicology fellowship out there that you're not going to get the knowledge that you need to be a great toxicologist. So, you can't go wrong with a toxicology fellowship. You're going to learn what you need to learn, but the question is, how do you learn it? And so what I would want to know, and what I expect applicants to ask, is, how are you going to teach me toxicology? Is the fellowship mostly poison center based? Is it mostly inpatient consults? Do you have an inpatient service that you admit to? How do you do didactics? Journal clubs, M&Ms, chapter reviews, all of those things. How am I going to be, how is my week going to be structured? Mm-hmm. And then I think another real key question is, how do we get to learn about outpatient and industrial toxicology? That is a real key thing and can really be different among the programs. I think every program teaches those topics in a different way. Otherwise, I think you can ask about what happens to fellows after they graduate. What kind of jobs are your fellows getting, and that'll give you a little insight as to what the typical typical graduate of that program does. And then I think it's real key to have some time with the current fellows and talk to them about how they like their fellowship. What is the what is the details of the fellowship? Talk to them about wellness. Talk to them about the support you get from faculty members and things like that. And I think those are the types of questions that I would ask if I was interviewing again.
Okay. Well, these are much more legitimate questions than I suspected your subspecialty would ask. I think about across town at Toxicon Consortium, they each have their own element, right? Like each fellow is like selenium, and I really expected that's where you were going to go with this. And then the lava lamp thing, I just don't get why you all own one. But these are questions for another hangout. We are sort of done. Michelle, what final questions do you have before we kind of close our time here?
Oh, I'm ready for us to hear the last segment, because this is always my favorite part. And while you guys were talking, I swear I was listening, but I'm working on putting my application in. I swear I was paying attention though.
You are as legit as all of the Republican candidates' moms and wives and Nancy Reagan. So I think that's great. Yeah. Let's actually start with Chris, because I know time is of the essence for him in Denver right now, and we're going to close our segment by saying thanks. And in a famous way, as we do on these hangouts, I want to learn a little bit about each of your programs. This is your chance to plug your program. So let's start with Chris. Tell me something that I don't know about Rocky Mountain Poison Center.
Well, first of all, thank you for the invitation. It's been fun. About Rocky Mountain Poison Center, we are a little strange in that actually our fellowship program is a little strange in that one of the things that I laugh about that our fellows recently was having to do was going in and we are a part of this black widow spider anti-venom trial, and our fellows for the most part, enjoy going in. But I can tell you about our fellows that we're picking for some reason here recently is that we have some pretty morbid fellows who enjoy watching these patients at the bedside after they've been bitten by black widows, and enjoy coming back and talking about how much pain they're in, and giggling and rating their pain scales during these clinical trials. So that's one very weird thing about our fellows here recently, but that's our Black Widow trial that we're doing right now is a lot of fun. It's pretty much done. We're just now collecting the data. So we're involved in this big trial. We have a couple of other trials going on that are pretty cool to be involved in, and we have a whole lot of different things going on from the industry side, our clinical service, our clinic, and all that good stuff. So it's a nice place to be, and the weather's not bad here. Although Ben, I can't beat out Ben. I can't for OHSU. You guys' weather is pretty good, and I like Portland a lot. But for Ben, can't really compete with that.
I don't know if you guys can see.
That's just not fair, Ben.
Stop gloating. Stop gloating.
The sun is out for one day here in Chicago. It's the one day a year that I get to film in sunshine. All right.
Yes.
Well, I appreciate your time with us. I know that you do have a pressing engagement here, but let me say, world, that Rocky Mountain Poison Center is world-renowned. It is one of the gems of the toxicology world. I sent one of my grads there what seems like many, many years ago, and she was so excited to go there, and we both knew that it was just an outstanding place to send her, and she came back thrilled she spent her time there, though I swear she was there 3 years. So I don't know.
No, you're right. She was. She did an extra year. She got an MPH and
all right.
Extra year.
She's a smarty pants. Amy's also at MCOW now.
That's
all right. So thanks for training her. And world, check out Rocky Mountain Poison Center. So now let's go to sunny in California. Thank you. And Ben, I would love to know something that I don't know about San Diego's Poison Medical Toxicology Fellowship.
Well, perhaps little known about San Diego. I know I just showed you a stereotypical day in San Diego.
Stereotypical.
You know, it's usually 75 degrees, early morning cloud, afternoon clearing. But actually, San Diego is a fairly diverse geographical area. We have a coastal region, we have an inland region, a mountain region, and a desert region. Because of all that, we get fairly diverse poisonings and envenomations. And really the thing that I think I saw the most in San Diego after I got here, I'll tell you that, I did training in a very diverse place in Fresno, California. But it's in the central part of California. I didn't see really very many rattlesnake envenomations. We're right next to mountains. We're right next to desert out here. We see a bunch of rattlesnake envenomations out here. I did not see a single stingray envenomation in residency. As you can imagine, it's kind of like seeing a stingray envenomation or a shark bite in Chicago. It's like, what the heck is going on? And so just last week, we had 7 cases of stingray envenomations.
That's insane.
We have our share of black widows, brown widows now that are taking over and displacing all the black widows. But I think that's partly a part of the fun. People are out and about in San Diego. They're enjoying the climate, and they're getting envenomated. And that's one of the things in San Diego that really is unique from a training perspective.
Well, and that's a great answer for tell me what I don't know, because I wouldn't have necessarily thought about that. I would have just thought sun and sunshine, and it's perfect to live there. But yeah, stingrays. I mean, we don't have that here. I was trying to think of the poisoning in Chicago that you don't have. I can only think of like the stuff I throw in my driveway to make the ice melt. Maybe that's it. So yeah, Toxicon is not happy about any of this right now. But world. Ben is one of my favorite program directors in emergency medicine. Don't tell the other program directors that, but he kind of is. So I had to have him on the panel, even though he's not technically a fellowship director. I trust his sage wisdom on many different things, and you absolutely have to go work with him. So check out UCSD. And then we're going to close with Rob up in Oregon. Tell me something I don't know about your fellowship.
I got the final word. Thank you. Well, actually, I think the thing that's truly unique about our fellowship, besides getting to live in Portland, Oregon, which is beautiful, is our geographic catchment area. And so when our fellows are on call for our poison center, they are covering calls in Oregon, Utah, the state of Alaska, island of Guam, and the Northern Marianas Islands. And so truly tropics, forest, desert, tundra, city. And what that brings to our fellowship is a really, really nice mix, and it really adds a tremendous amount of breadth to the training program. You know, we have the typical illicit drugs and overdoses in Portland, which we see at the bedside. We have a tremendous amount, gigantic foraging community in Oregon, very stereotypically so, and we see a tremendous amount of mushroom toxicity and plant poisonings as well, and those typically get flown to our tertiary care center, so we get to see them at the bedside too. We take care of snake bites from eastern Oregon and from Utah. We get calls about some unusual marine envenomations in Guam, lionfish, stonefish, and then the coast, Pacific Northwest coast and Alaskan coast. We see and get to take care of patients who have paralytic shellfish poisoning, amnestic shellfish poisoning, and then finally Alaska. You know, and Alaska is a very unique place. There's a tremendous amount of botulism in Alaska. There's a tremendous amount of toxic alcohol ingestions. And I think that the thing that the fellows get the most out of is research, a tremendous area and very resource poor in certain situations. You know, it's very easy to send everyone into the hospital to be observed for 4 hours, but when you are getting a call from Gamble, Alaska, and it is a 7-hour, 1,400-mile flight to a hospital, you have to get a little bit creative. So it allows our fellows to really think about, you know, why am I sending this person in? What can actually happen? What's the statistical probability of that happening? And what can I do, frankly, you know, in a health center or their living room up in a small town in Alaska? So I think that's probably the most unique thing in our fellowship. And it certainly does make for some very, very interesting stories, which I don't think we have time for, and also some very exciting nights. So that's it.
All right. Well, I mean, I
want to keep my fellowship now.
I know. I have so much to say about this. First of all, Gamble.
Sign me up. Sign me up.
Names, right?
Oh, and also, I have to share with you, our weather's not too bad either. So,
right.
Despite the reputation, it's pretty nice out right now.
Well, so, all right, again, the things that I took away from your answer: one, Gamble is appropriately named.
Absolutely.
Yeah, it sounds like you take a gamble living there. Two, foraging communities.
Yes.
This is why Portlandia exists. Okay? Terms like that.
It's true.
You know, foraging community is a very different entity in downtown Chicago. It really is a much sadder social situation. And then, you know, those are just cool things you talked about, and that's the theme with toxicology, is that you guys just have the coolest stuff to talk about all day, which makes it the coolest subspecialty in EM, I think.
Of course.
Because of that. But, you know, I too have sent a grad to Oregon, and she was very happy, as I recall, during her training. And, you know, I've said on other match advices about just your department in general, you guys have the neatest faculty. You have such broad interests and experts in everything. It's got to be so great to be faculty there. So residents, check out Oregon. If you didn't for residency, you've got to check it out for fellowship. It's a great place to be. All right, with that, thank you guys for being on our panel. And Michelle, any final words?
No, I really should have been a medical toxicologist. I'm just now regretting everything.
No. After we hang up, you won't think that anymore. But okay, I was expecting a plug for how great San Francisco is, just because. All righty. Thank you guys very much. Good luck with your applications, residents.